it's not that AI will replace the physician, it's that the physician who uses AI will replace the physician who does not use AI.
Artificial intelligence is all over the news. There's a lot of hype, there's a lot of fear. But what I want to know, what is AI? What is artificial intelligence?
The power of AI is taking a lot of data and turning it into knowledge, trends, useful information.
The opportunity of AI is to take this massive amount of data and to improve humanity.
I like to think of AI as augmented intelligence rather than artificial intelligence. When I was trained, we were taught that medicine could only affect 10% of health. The rest of it were socioeconomic factors, social determinants of care. Now that's in our realm, we can bring that data in to deliver care much more effectively. And AI is going to help that.
In reality, less than 50% of the decisions physicians make is based on really strong data. So I think everyone is still very excited about the opportunity to get these large amounts of vast data and to use AI to really lead to better understanding of human health and disease.
Of course, there are risks. When you think of all the data that we have, so much of it is based on research where there weren't a diversity of participants.
Well, there's inherent bias in the data, to your point, that our data sets often are not in the most diverse pools, whether it's from clinical trials or other aspects of data that's collected. Sometimes we have the absence of data on some populations that may not have the social environmental support to have those data points. So this is something we really need to think about, is the bias of our data sets and also our judgment. And we need to make sure we don't perpetuate those patterns, because that's what we see in the data we put into AI algorithms.
And as you're talking about it as augmented intelligence, you still need to have people intentionally doing the work to recruit diverse patients into trials and things like that.
Yeah, and it's important that there have been bodies that have come together and really put some guidelines around ethical AI and ways to decrease the bias and be more aware of it in the data.
Steve, I've heard you talk about this as the golden age of medicine and discovery. And AI has a role to play in that. Tell me about that.
Well, AI is really taking off today. A lot of the advances that we're making, and we're making incredible advances, are due either directly or indirectly to this increased computational power, our ability to sequence the whole genome. This type of knowledge is leading us to be on the verge of understanding the molecular basis for humankind's most pressing diseases, which then could lead to cures.
Well, we're in a wonderful position here, having a strong medical school, a strong engineering school, and a partnership. We're both very interested in how AI affects healthcare. We're also in a diverse, large urban community with lots of variables to look at. And we're setting on some grand challenges in areas we want to explore further, whether it's in some specific disease cases to understand who may benefit from certain therapies or diagnoses, or the complexity of all these variables coming together in diverse populations.
Nutrition, behaviors, purposefulness, wearables, putting all this information together really will require AI to allow us to understand the diseases that patients are susceptible to, and for any individual's disease, what's the course of their disease? What complications are they likely to experience? What's the best treatment? All of this that we call precision health is really an opportunity made by AI. We're doing a lot of this here right now. The Neuroimaging Institute, the Stevens Neuroimaging Institute, is one good example where we take MRI images, combine that with genetics and other clinical features to really understand the human brain and health and disease.
I think those of us who embrace the intersection of technology and medicine are excited to see it go forward and how we can use it to, again, deliver better care.
Another big potential shift we talked about in medicine is care delivery. How does AI play into that?
So, understanding how to best serve patients when they need to come into the hospital, how to coordinate their care better. That augmented intelligence, the physician with AI, is going to function better, and the hospital system with AI is going to function better than without.
If the machines are doing some of this quantitative work, this frees the physician up not just to spend time with patients, but to show the empathy. And we could have more reasonable work hours because we're a much more efficient system, which would lead to more productive lives. So I think from a burnout standpoint, there's nothing wrong with having a little help.
It sounds like you envision AI as giving healthcare providers more time to spend with patients to do what they want to do rather than taking jobs away.
Absolutely. I mean, as we use technology better to deliver better care, the right care to the right patient at the right time, it's not that AI will replace the physician. It's that the physician who uses AI will replace the physician who does not use AI. Fields move forward with technology. So we may not be doing exactly what we're doing today when physicians diagnose disease, but with technology, with AI.
One thing we haven't talked about is its role in drug discovery. That's happening now. AI is already starting to contribute to research that can help us identify new treatments. Talk about that a little bit.
Well, I just mentioned one way. I mean, when we think about how drug targets are often compared with large inventories of compounds, you should see that screening so much faster. So that can really help identify what may be a small group of potential drugs that could work in a situation.
Even more impressive, I think, than ChatGPT is what Google has done with what the DeepMind company has something called DeepFold. A big problem in finding drugs and targets is that proteins fold in various dimensions, and it's very difficult to predict how a protein will fold just knowing its structure. They've actually solved this problem of protein folding, which really will allow us to figure out how a drug can bind to a protein and be a new target.
Carolyn, in your experience, do you find when working with students, are they concerned about artificial intelligence?
Yeah, early in my field, in my career, I was working a lot with computers, and it was always hard for me to find students who could help with my research projects because they didn't often have those computational skills. Now our students are digital natives, so they're more comfortable than those in my generation, even those of us who worked with technology. So I think they understand how that's a natural part of life that continues to support progress in every aspect of what we do.
Just by having all of this incredible wealth of data and AI algorithms, we're going to be able to, as we do here, ignite discovery, have our scientists, our students, our physicians, our clinicians, everybody ask the most important questions, challenge dogma, because it might not be right. Once we have all this information, we then can generate hypotheses, take that to the lab, and make real discovery.
And it's that kind of thinking that is what our students are about, what Keck is about. That bold thinking, igniting discovery, and not always following the expected path.